Good evening and welcome to the COVID-19 update. I'm Kayode Okikulu. First, the highlights. Experts warn citizens and frontline workers not to relent in hand hygiene because it could break the chain of infection. And Lagos moves to avert a third wave of COVID-19 by employing technology to monitor infected travelers. And Seychelles brings back COVID-19 restrictions amid rise in cases in spite of vaccinating 60% of its population. Well, it's still World Hand Hygiene Day, and so much has been happening in that light, both nationally and internationally. We'll bring you that in a moment as we keep our eyes on the COVID-19 figures and the story behind those figures, bearing in mind that there are real people behind those numbers. The NCDC's latest report shows that 34 people have come down with the virus in the past 24 hours. Here's a breakdown of our battle against COVID-19 so far.
Adherence to non-pharmaceutical interventions remains one of the most effective ways to curb the spread of global coronavirus pandemic. The World Health Organization is using the World Hand Hygiene Day celebration to call on healthcare workers and facilities to ensure effective hand hygiene action at the point of care to prevent transmission of infectious microorganisms during healthcare delivery. According to the latest update by the Nigeria Center for Disease Control, NCDC, there are still over 7,000 active cases in Nigeria, and the country has recorded no recoveries from isolation centers across the country in the last 24 hours, leaving the total number of recoveries at 155,371. The fatality toll in Nigeria has continued to decline over the past weeks as there were no casualties in the last 24 hours, leaving the figure at 2,063. The agency says Nigeria has recorded 34 new infections in 4 states last night. This includes data from Enugu State recorded between April 28th and May the 3rd. 19 new cases were reported in Enugu. Lagos recorded 13, while Kaduna and the FCT had 1 case each. The latest tally raises the total number of confirmed cases in Nigeria to 165,215. Members and staff of the National Youth Service Corps, NYSC, can now access the COVID-19 vaccine in all NYSC secretariats across the country. This is according to the National Primary Healthcare Development Agency, advising Corps members to protect themselves and ensure that they get vaccinated. In its latest update, the agency reports that 62% of Nigeria's target population have received the first dose of the Oxford AstraZeneca vaccine, with Lagos leading after vaccinating more than 200,000 of its target population. Globally, there are now more than 154 million confirmed cases and more than 3.2 million deaths across several countries.
Seconds save lives. That's the message from the World Health Organization and global experts as they mark the World Hand Hygiene Day across the globe to achieve hygiene at the point of care. Well, here in Nigeria, the Center for Disease Control, the NCDC, is leading the advocacy to break the cycle of infections. Speaking at an event in Abuja, the nation's capital, the head of disease prevention maintains that the burden of healthcare-related infections can be reduced by imbibing the culture of proper hand hygiene at the point of care.
Seconds save lives. Wash your hands. A slogan that precisely echoes the importance of hand hygiene in the management and control of infectious diseases, as officials of the Nigeria Center for Disease Control and the Federal Medical Center, JABI, mark the 2021 World Hand Hygiene Day. Distributing flyers as they march through the streets of the nation's capital. The message on the importance of hand hygiene for the management and control of infectious diseases is spread to both health workers and patients. Launched in 2009 and celebrated annually on the 5th of May, the World Hand Hygiene Day aims to promote the culture of hand washing and reduce the spread of diseases.
If a mother washes her hand before she prepares her child's food, for instance, the chances that that child will have diarrhea is reduced. Even if somebody came to the hospital and health workers are diligent in observing those 5 moments, If the patient himself is diligent in hand washing, if the caregiver is diligent in hand washing, then the chances that that disease will pass from one person to the other will be reduced.
Proper hand hygiene is one of the recommended non-pharmaceutical interventions for the management of COVID-19. At this news conference, healthcare practitioners stressed the importance of hand washing in breaking the circle of infections.
As simple as hand washing looks, it actually saves so many lives. Because most infectious diseases are actually transmitted through contact from the hand back to either yourself as a person or transmitting it to another person.
The second, in this case, where you spend washing your hands under a running tap can save your life because you don't know what you've picked up on your hands. You don't know what germs is in your hands.
Proper hand washing under running water has been advocated over the years to be the cheapest and safest protection against highly infectious diseases such as Ebola and COVID-19. Although safe and cheap, the practice remains a huge challenge in Nigeria, as about 100 million people do not have access to basic sanitation facilities, and 63% of the country's population do not have access to potable water.
And away from the nation's capital, Abuja, let's show you how the World Hand Hygiene Day was marked in Edo State, as healthcare workers being reminded about the importance of this simple but yet vital procedure at the point of care to break the chain of infection. Healthcare professionals under the aegis of Infection Prevention and Control Committee at the University of Benin Teaching Hospital took this message to colleagues, patients and visitors around the different sections of the facility.
Infection Prevention and Control Committee members at the University of Benin Teaching Hospital, Benin City, the Edo State capital, heeding the WHO's call to ensure healthcare workers and facilities achieve effective hand hygiene action at the point of care, embark on a sensitization walk around the facility. Their message takes them through different wards at the hospital.
Ensuring that we achieve hand hygiene at the point of care will make sure that we reduce healthcare associated infection, the spread of healthcare associated infections.
3 elements are said to come together at the point of care: the patient, the healthcare worker, and care or treatment involving contacts with the patient or their surroundings. The reason hand hygiene is essential.
Hand hygiene is very important, and of course, without missing words, it has helped in the control of the COVID pandemic, particularly amongst health workers.
With the COVID-19 pandemic still around, there's a reminder that it's easy and important to keep the hands clean regularly, even outside the point of care.
There are other instances where we need to also talk about the use of alcohol-based hand sanitizers. That is usually more convenient, especially as we engage in our day-to-day activities.
According to the WHO, the 5 moments for hand hygiene at the point of care are before touching a patient, before clean procedure, after body fluid exposure risk, after touching a patient, and after touching patient surroundings. Jessica Olugwese, Channels Television News.
Well, let's talk some more on this important pillar in our fight against COVID-19. Professor Richard Kimball is a research consultant with NIMR, that's the Nigerian Institute of Medical Research, and he joins us live on the program this evening. It's great to have you on COVID-19 Update. Seconds save lives. That's the message this year. And if I could just ask, how many seconds are we looking at here?
A few seconds. Anyway, good evening and thank you for having me on your show.
All right.
I think the World Hand Hygiene Day couldn't have come at a better time today, given the problem with COVID-19 situation globally. And we all know that one of the recommendations, the non-pharmaceutical recommendations to stop the spread of this disease is actually frequent hand washing in the proper way to remove the virus for contaminating us and contaminating surfaces. One good thing about microorganisms that we should mention is that they do not fly. We have to pick them from one spot to another. And clearly, the common sense measure is that if we reduce the number of viruses or microorganisms that we carry on our hands, we then reduce the chances of moving them from one spot to another, of one person to another, and reducing the spread and the disease in the community.
I just realized.
A few seconds of hand wash can save your life.
You know, I just realized that for as far back as I can remember, my mom had always, told me, wash your hands when you get into the house, wash your hands. If you go to the kitchen, wash your hands. And here we are now, still the same message. So I'm just thinking, maybe we would have avoided this whole pandemic situation if we had listened to mothers.
Yeah, 100%, you're correct. And mothers say many things that we don't listen to, either because I guess when something is rather cheap and it doesn't cost us something, we are reluctant in responding to that. If it is something that is scarce or we have to pay for it, and then we do all that we can to look for it and to get it. If we look at infectious diseases in general, and we look at it globally, most infectious disease deaths, apart from the pandemic that is happening everywhere, actually occur in developing countries, including Nigeria. In fact, over 90% of deaths from infectious diseases normally occur in those countries. And common sense methods like washing your hands, improving our water source, giving potable water to people, we actually reduce a number of them without needing any drugs or even vaccination to some extent.
You touched on a very important
point. So it goes a long way.
Yeah, you touched on that point of access to potable water, because, what's hand washing without water, which is a key component? And, that's at the bulk of the government, definitely. But, aside the MPIs, the pharmaceutical measures or, interventions, for example, which we've seen is vaccination. And Lagos, for example, has vaccinated just about 1% of the target population in 2 months, that is. You see, at the national level, 0.6% at this rate. So it looks like we'll hit that 70% we're looking at in 11 years and 8 months. I actually did the math. That's 2033. So are we expecting any miracle here? We've talked about MPIs, now the pharmaceutical interventions.
So let's talk about vaccines. And the countries that are ahead of with regards to vaccination against COVID disease is obviously the United States, where they have vaccinated about a third, over 100 million, fully vaccinated in their population. And the Israel, although smaller countries with about 9 million people, have already vaccinated about 60% of their population. In Africa, it's going to take a long while to get there. But efforts are being made actually to make sure that vaccine.
Prof, I think you may have muted the microphone or something is clearly wrong with the audio. But I think we have you back. Please go ahead.
Well, I guess the point that I'm making is that it's going to take a while to get vaccines to the country that have to wait a little bit to get them. What is important to note is that there's an organization that's spearheaded by WHO called COVAX that is coordinating, making sure that the equitable distribution of access to vaccines from different manufacturers and companies. And that's going on well, and hopefully with increased number of vaccines that are being approved for emergency use, we might see actually a better the system of distributing vaccine and making them to reach more people, particularly in developing countries that are dependent for getting their vaccine through this COVAX organization that is led by WHO.
Right. Prof, on a final note, you consult with NIMR. Should there be some cheery news we should expect from NIMR regarding vaccine production or any breakthrough, really? Because there's been a lot of talk about homegrown capacity.
Well, that's actually a good question. And I'm not a spokesperson for NIMR here, but I work there. And incidentally, actually, I was really impressed by what I saw yesterday by one of the scientists there. that's actually working at the early phase of vaccine development. And so there are, and I know that there are a couple of other places where we are working on that. But one caution here, though, that vaccine development and production do not happen overnight. We need to invest on R&D and do preclinical studies because vaccines are given to healthy people. There is zero tolerance for error and mistakes. And so it takes some time. And I hope that what we can learn from what is happening now is to prepare for the next time around and ensure that we invest on R&D that can lead to vaccine development and production in Nigeria.
Prof, that's clearly something to chew on. But we'd like to thank you so much for sharing your thoughts with us on the program. Professor Richard Kimball is a research consultant with NIMA. We appreciate your time.
My name is Adebola, actually. Pardon me. Thanks for having me.
Great to have you. We'll go on a break now, and when we return, we'll take a look at the situation in India. Do join us again. You're welcome back. Well, you may have heard and seen heart-wrenching stories and videos from India as the country battles a massive wave of COVID-19 on a scale that makes what we've seen in some other countries look like child's play. Close to 400,000 daily cases. Now, for context, that's about the population of Bahamas. And fatalities, as at the last count, over 222,000 people have died. Now, oxygen is in short supply. Some call it the new gold. Well, there isn't enough space at the crematoriums. It's a lot, really. But let's bring you some clearer view of what's really going on in India this evening. And we have joining us on the program, Nabila Jamal, a journalist in India. She joins us live from Delhi. Well, Nabila, it's good to have you on the program. At this rate, India accounts for about half of the world's new cases and 1 in 4 global COVID-19 deaths as well. Well, the natural question a lot of people have asked time and again is, how did this happen?
Well, thank you very much for having me. I wouldn't exactly be able to define a reason to why this happened, but certainly India wasn't prepared for a crisis like this. We did know that a second wave was impending, but we did not know that this was the magnitude with which it's going to hit the country. Experts, the scientific community say that this could be the mutant variant, which is a lot more virulent, a lot more deadlier. And this is the mutant strain that's found in India, at least unofficial reports, as unofficial reports as now go by. At least 103 mutant variants of the COVID-19 virus has been found in India. Again, this is unofficial reports. There's no certain specific data on this as yet. Right now, genome sequencing is still underway, where they're still trying to understand the nature of the mutant virus. But we do know that what we do know right now, that this particular mutant is a lot more infectious and a lot more deadly. It's resulted in at least over 3 million deaths that we look at today. We're looking at daily case count at 380,000 cases on a daily basis. Just today, we lost 3,780 people to COVID-19. And this is resulting in serious panic in the country. We're seeing the entire healthcare system maxed out at the moment. And we are seeing serious shortage of supplies, medical equipment, medical staff who are currently not sufficient enough to really treat this onslaught. The people who are coming into the hospitals are a lot more than what the infrastructure is currently that would cater to. India never imagined a crisis like this, and this has really hit us hard.
But, media reports have blamed flouting of social distancing and mask wearing. We've also seen those mass political rallies and religious events, such as the Kumbh, where we saw hundreds of thousands of Hindus gather at the Ganges River. So, it was always coming, some would say. Was that a government or a people failure, or both?
Well, I would say it's a collective failure, absolutely. For the only reason, because the government... on one hand, it was their responsibility to flag off the severity of the situation much in advance. But as per what we saw, that they projected for it to look like the worst was over. The government did not anticipate this kind of a second wave that would hit us. In fact, like I did mention, they did not, by the time they really understood the seriousness of the mutant virus, it was too late. So it appears that they flagged it off a little too late. By then, people had already relaxed, and India took a victory lap. We felt like the worst was behind us. We started off with a great footing. In fact, India was the one who's very initially started off with the vaccination drive. In fact, supplied vaccines to several countries. We've supplied about 64 million vaccine doses to about 84 countries. And we started off on a really strong footing. We went into an early lockdown, and that was all thanks to the government at that point of time. We did see that the government took the right decision last year to ensure a quick lockdown to curb the virus right there. But during the months of December, January, in fact, it started dipping around the month of September, October 2020, all the way to January, February, we saw a dip in cases. And that's when it appears that India let its guard down, all of us collectively. And I wouldn't say the leaders led by example. They too indulged in massive political campaigns. There were 5 state elections in the country that was underway. Politicians were out there indulging in campaigns, and you do know the population of India is 1.4 billion, and any given political campaign, you wouldn't see anything less than 1 million people in one congregation. We had religious congregations, various festivals. People celebrated India as a country that indulges in religious activities very earnestly, and we saw people coming together in large numbers, and there was no restriction, and that was what I think led to a massive collapse.
I don't know if it's too early to ask, but when is India likely to peak?
Well, I think we're living the peak at this moment. This is not my view. This is what the scientific community says, that we're currently seeing a peak, and it could possibly be or remain worse until the next week. That's what the scientific community estimates. But owing to a lockdown in a few states, we're also seeing a dip in cases. So let's just hope that there's something we're able to flatten the curve as soon as possible there.
Okay, just one more thing, Nabila. We've seen help coming in from, parts of the world, the UK, US, Canada, UAE, Singapore, sending in medical supplies. Ironically, those countries have also placed a restriction on travel from India. So how are you receiving all of this, really?
Well, this is precisely what India did as well. At that point in time, when United States was seeing a serious surge in COVID-19 cases, India also restricted travel of people from the United States into India. And India also sent out an advisory to people within the country not to travel to the United States. We saw United States being one of the worst hit countries so far. But it seems like now the tables have turned around. But despite that, India also helped United States at times of need. India supplied doses of hydroxychloroquine at that point in time. Medical supplies were given from India as well. We aided the United States at a time of need. And we're seeing the same that's happening right now. Right now, India is seeing a surge. Several countries have banned travelers from India coming into the countries, but they've also stepped up at the same time to aid in this humanitarian crisis. Because what we need to know is that unless and until all of us are safe, none of us are safe. About 40 countries have now come forward to give out aid. United States itself, the consignment has reached just yesterday. Oxygen concentrators, ventilators. We're looking at tankers, medical supplies that are coming in.
Right, and I see that hashtag Stay Strong India trending. But I'd like to thank you so much, Nabila Jamal, for sharing your thoughts
Thank you very much for having
the program.
me.
And please stay safe. Well, back here in Nigeria, less than 1% of the target population in Lagos have now received their first jab of a COVID-19 vaccine. The State Commissioner for Health, Professor Kimball, who stated this at a ministerial media briefing, warns that Nigeria stands the risk of a third wave. And to prevent this, health facilities in Lagos have been placed on high alert. He says other ongoing efforts by the state government include the deployment of a core telemed, a tech-driven platform for the management of inbound international travelers from high-burden countries.
We have achieved what we call 1% herd immunity. We still have 14 million people to vaccinate, and we need to hit what's called 60% of the population have received the vaccine, which will be one of our key strategies to mitigate a third wave. I think it would be very unwise to think that we are not vulnerable to a third wave, and that a third wave would not cause as much damage as we're seeing on television in India, Brazil, and South Africa. We're now deploying EcoTelemed to monitor inbound travelers. So anybody coming in, any of you who've traveled abroad to a place like UK or America, you will know that you will receive a phone call every day to make sure that you're isolating in your house.
Well, don't forget to protect yourself. The virus is still out there. Continue to take responsibility and visit our website, channelstv.com, for more updates and better understanding of the pandemic. We also have all the big stories from politics to business, sports, and so much more, all at your fingertips. Well, that's the COVID-19 update. Thank you for watching. I'm Kayode Okikelu.